improves. Their feet start getting warmer. Their blood pressure drops. They start looking better. Then after a few more treatments, age spots that you see in the back of the hand start going away. Wrinkles start smoothing out, and this takes care of wrinkles too.
Oh, really? Oh, that's very important.
So the good thing is that it takes care of wrinkles from the inside out, not just the ones on the outside. And it increases circulation everywhere. So it's a rejuvenation process also that the chelation can do.
That is wonderful.
Together with other things, of course, because you take out on one end, it's important also to put in from the other end.
Yeah.
Minerals and nutrition.
So how do you know that your patient is doing good, is doing well?
We monitor them clinically, which is the most important monitoring, by asking them questions and see how the symptoms they had before are doing after. Number two, we do physical exams that tell us how the color of the skin, circulation, age spots, blood pressure and pulse are doing. We measure the blood pressure in the lower extremities to see how is it improving, so the patient can see their progress. We also take the blood pressure regularly so the patient can see the progress. And many things start getting better. They start feeling it, which is, again, what I was saying in the beginning, that feeling is the best monitoring there is.
There is an association of alternative medicine practitioners, doctors?
There's an American College for the Advancement of Medicine. And we have together implemented the American Board of Chelation Therapy. And these are physicians that are committed to the implementation and the education of chelation therapy and other natural treatments, other alternative and complementary medicine treatments in the United States and around the world.
That is wonderful what you're doing, Dr. Vega.
Thank you.
How do you control the doses on the patients? How do you know what they need? How they're doing with those specifications?
That is
medicine.
I have two ways of doing that. One is by the physical exam and the physical manifestations.
Okay.
And I follow that physical exam, x-rays that may show tumor shrinking. Physical exam may also show tumor shrinking. Number two, I use also the subjective or symptoms. I write down everything the patient is feeling the first day. And then a week later, a month later, I see how many of those he still has. That's another way of doing it.
How your first interview with your patient goes?
It goes the same way we're doing here. We're talking and we're listening to each other. I talk to the patient, and it's interesting because I notice already many of the things that are going on by the way they talk, by the way they look, by the color of their skin, their eyes, their mouth. Just by observation, I can tell 80% of what's going on with them. Then I listen to what they're saying because that tells me what's going on inside of them, in their mind, in their heart, the feeling. That's very important too. And what their belief system is, what they believe in, what they don't believe in. And using all those things, I start devising a plan of treatment that is tailored to that individual.
Well, you know that we are it's late to time on TV, but we have so much to talk about, all this alternative medicine and different treatments that you are doing in your clinic.
Absolutely.
I want to invite you for the next program, and specifically if you can talk to us about cancer protocol and, all those treatments that you're doing.
I will be delighted.
And I would like you to leave a message to our teleaudience.
I will tell the patients to pay attention to anyone that you encounter, family members, doctors, because you're in charge of anything that you do for your health and anything else. And if you pay attention to these things, you cannot go wrong. And don't let anyone tell you what to do.
Thank you very much, Dr. Victor Marcial-Vega, for being with us today.
Thank you for having me.
And we expect to see you or to be with us in the next program. Thank you very much. Take care of yourself. Until next time.
Thank you.